Have you ever wished one of your pets could speak a human language? Yeah, me too. Especially in my line of work. I'll tell you what though, they would share their happiness with us, wouldn't they? But they'd also try to share their pain, especially dogs. Now cats, we've talked about this, they can be pretty recalcitrant. They are a predator and a prey species, so cats don't necessarily want to say anything. You've got to know what to look for. But you know, with cats and dogs, sometimes we have a pet who cries, acts withdrawn, and that can be quite telling, but there are some others that react aggressively to even the hint that they might get touched. Well, I have a story for you about a little dog named Petal, like Rose Petal, little Chiweenie, the half Chihuahua, half weenie dog, and she is a very cute dog, but she had a very severe injury. But please stay with me, this story has a happy ending. And in case we have not met, I'm veterinarian Dr. Jeff Nickel, along with the Nickel family border collie, Miss America here. Girlfriend, would you look at the camera and say hello? Here, sit up. There you go, thank you very much. And I have Gaston. Carolyn, would you hand me something that would lure Gaston onto the writing table? He's luxuriating on the rug on the floor of my office here at home. Anyway, Tony is not with us this week. Tony is in the hospital, but it's a very good thing, and I'll explain a little bit more about what's going on with him a little bit later in this Facebook Live. And in fact, next week on Thursday night, he'll be back home, and we'll talk about what's going on with that little rascal, because he's 14 years old. He's bearing down hard on 15, and he has a problem that's common in older cats. So we'll talk about him a little bit more. But at this point, we have Miss America here, and we have Gaston, the white fuzzy guy, who has, by the way, a new toy, which Carolyn will add to the mix here in a few minutes. And that is quite interesting. So, tell me, have you had a pet who's had a pain problem? If you can hear me loud and clear, please hit the wow button. And also, if you find this information helpful at any point, please send me some of those little hearts. And if you're watching, please tell me that you're here and where you're from. I really like to get questions. If anything comes to mind about a cat or a dog, if it's pain related or anything, physical or behavioral, I've been at this so long there's hardly anything I haven't seen. So please send me your questions. I am residency trained in veterinary behavior medicine, but I've practiced general medicine for over 40 years. So I know my way around these little creatures pretty darn well by this time. Thank you for the hearts. I'm glad that already we're saying something useful. So let me tell you this story. This is a little dog named Petal, again like Rose Petal, and she's about 5 years old. She belongs to one of the best good-hearted people I've ever known, and it looks like Cindy, you're here. Thank you so much. And Ann Manners. Ann, wonderful. Ann's my sister-in-law. Thank you for coming. Carolyn's going to fire up my iPad here in a minute so I don't have to lean into my iPhone where we're getting this stuff. Anyway, let me show you a picture of Petal. And you can see that she's wearing a pretty serious bandage on her rear end. And I'm going to explain why in just a second. And the reason is that Petal, let me use my cheat notes here so I don't leave out any important details of this case. She's been living with her new people for the last year, but shortly before she was adopted a year ago, she had some kind of a severe injury, and we don't know because she was found stray. But I can tell you from having dealt with so many hit by car injuries over the years that her x-ray makes it look like that's what happened. Now this is an x-ray of both of her back legs, and let me move it up just a tiny bit here. There we go. Can you see anything interesting about that leg I'm showing you there? Here, I'll back it up a little bit so you can see them both. There you go. I'll give you a hint. The one that is poked sort of horizontally to the back is actually normal. And the one in the down position right here is missing the bottom end of it. And that portion was not surgically amputated. That was missing when Petal was found. And it was raw and open and in horrible condition. And in fact, thank you, Carolyn. And in fact was the the biggest reason she came into the emergency department. And this is something that dogs do. We know the expression, lick the wound. Well, Petal was chewing this to the point where she was making it much worse, and the bone was infected. I don't mean to gross anybody out, but this was a remarkably serious problem, and clearly exceptionally painful for Petal. Well, there's more little food in there, buddy.
You want that? Tell me when you want the other big bowl.
You give me a few minutes. Do you have another of these little indoor hunting feeders with food in it? I can give you one if you want to fill one. Oh, you got one? Okay. Yeah, because he'll be kind of distracting when he plays with his new toy. These are supposed to look like mice. See? The indoor hunting feeder. And there he goes. He's poking at it as though it was a mouse. Here, Gaston. You know how to... Yeah, oh my goodness gracious. What an animal you are. Okay, so anyway, so, people think this little dog is very cute. Here's another picture of her. Well, she certainly is. She's delightful. And she has that little innocent look on her face. Well, she is. But people, friends of her person who adopted her would reach to pet this little dog because we love pets, don't we? And we love to touch them. And that's good for everybody. Except that as soon as somebody's hand even got near Petal, she would strike out quick as a snake and bite and cause significant penetrating wounds. This dog was serious. Any touch was a trigger for pain for this dog. So we don't want that, right? And we need to help her feel better. And of course, yeah, poor Petal, no kidding, Ann. Yeah, I'll tell you what, some of these cases break my heart. Whether in my days in emergency medicine and surgery or as a veterinary behaviorist, some of these things are rip the heart right out of your chest on these things. Well, by the time I'd seen her, she'd already had surgery to amputate that leg, which was essential because the bone was getting infected, the nerves were just overwhelmed, and we had to be done with it, and she couldn't use it anyway. And of course, it's a rear leg on a small breed dog, and they do just fine. Cats do just fine missing a leg, and actually they normally bear more of their weight on their front legs, so missing a back leg on anything up to a really big dog, actually, they typically do well. So a small young dog, we weren't that worried about her. So this was my initial impression, and again, she'd already started her physical therapy, but that was very dicey because handling her in the pool that has a treadmill in it and other physical therapy exercises, she'd already injured her person a few times, and the physical therapy veterinarian was a problem. So they needed my help to help with the behavioral end of this thing. So, she came into my exam room and she scooted around the floor on her own pretty darn well, but she wasn't bearing much weight on her other rear leg, her good one that she still had. But she would occasionally stand on it. And while she was sitting in her person's lap, her person petted her on her left side, and I said, hey, you don't need to trigger this dog's aggression. I get it. I understand these problems. Well, she wanted to show me anyway, and that little dog just swung around and went for her. And because her person was so well anticipating the issue, she got her hand away in time. But this was a serious problem. So we make diagnoses on this thing just like any other medical issue, whether it's behavioral, and very often behavioral problems have a physical component. So the first thing was pain-related aggression. And that's a fairly common major influence on aggressive behavior in dogs. And in some cases, it's the only cause. But we weren't sure yet whether it was the only cause, but I suspected that it wasn't. Because fear, based on Petal's body signaling and postures, the way she would retreat quickly when somebody reached very gently to pet her, there was clearly a fear element here. And then there was anticipatory aggression, and anticipatory pain-related aggression, meaning that if somebody came near her or reached for her, and she got the sense that she was going to get touched, and from experience knew that by lunging away to avoid the touch, she could cause herself pain by moving quickly. And so consequently, she would nail somebody who she thought even might cause her pain. So And finally, it became a self-rewarding behavior. Self-rewarding because people always backed away and she didn't get touched and she felt better. And Carolyn, that light is getting much better right now. Actually, you were better just another foot back. Anyway, Carolyn's working on the lights because this darn thing we've been fiddling with it since before we started this thing. So anyway, and finally it became a default behavior. In other words, without even thinking about it, it had become a classically conditioned behavior. Somebody's hand got near her and she would bite without even thinking, like a knee-jerk response. So first thing I told them was, beyond physical therapy, very important, but we need to medically diminish this dog's pain and inflammation, even though the leg that had been the big problem had already been amputated, which, by the way, another x-ray of her back end showed that she had a fracture to her pelvis. And on a small dog, they actually do better letting it heal by Mother Nature, but it hadn't healed completely yet, and moving those bones of the pelvis relative to each other, that can be quite painful. So we needed to help her, so we went ahead and stepped up our dosing of the anti-inflammatory pain reliever called Carprofen. The brand name is Remedil. It's not the only one in that class. There are others, but this is often a go-to because it is pretty darn reliable. So I explained to Petal's new person that how highly fortunate this little dog was to have landed in her home. This is a lady who had 6 other dogs, 3 of whom were disabled. She was just at a heart of gold, and she would do whatever it took, and she would accept a pet that needed her special care. Her person, by the way, is a nurse practitioner, so she's a medically trained person to begin with. So anyway, I explained that she'd suffered badly, this little dog, prior to coming into her home, and she'd become aggressive from that lingering pain and fear. So these reactions were self-rewarding. I think of it in some respects, it's the same kind of thing as Miss America does here, who doesn't really have much of a pain problem, but the UPS delivery person comes to bring packages from my practice and drop them off here at home, and she's of course fenced. Girlfriend, I want you to stay here. And when she raises a big ruckus at the fence and chases that poor man James off, and he jumps in his truck and he drives away, and she comes away feeling pretty darn good about herself. Worked again. All that threatening behavior of hers was something that she feels got rid of the UPS man. And so that becomes a self-rewarding behavior. How can I get her to stop aggressively chasing him along the fence when it keeps working? And she's territorial like any good dog. She's going to protect her family's home. So it's a self-rewarding behavior because it seems to work. So one of the most important things I needed to explain to Petal's person was, don't reach and try to pet this dog. Avoid all of that, and instead lure Petal to her, so that Petal's interaction with her person became Petal's choice. That Petal would come to her when she felt comfortable, when she felt safe. And I'm about to get this new toy, our cat's toys. Carolyn's getting it actually turned on right now. I'll show you in just a minute. I explained it was not offensive aggressive, but reactive aggressive behavior. So here we go, and here it is. Gaston, look, baby. Oh my goodness, what the heck is this? There, here he comes. Oh, it turned off just as soon as he got up here. Oh, it also has catnip in it. So, like any good prey, it moves erratically, and then it stops, and then it goes back to it. Anyway, it looks like a real trout. I went fly fishing recently, didn't catch anything. I was happy to see these. Carolyn had ordered them when I got home, and so he'll poke at it again, and it'll start back up. Go ahead, Gaston. So anyway, well, all right, where the heck else were we? So I explained to Petal's person, let's abandon those arousal, fear, pain triggers. Gaston, you're going to have to get used to it, buddy. So I got an email from her a few weeks later. She had started the pain medication.
I'll turn it off. You can enjoy it without the notification.
Okay. So I got an email from Petal's person a few weeks later, and here's what she wrote. I have not noticed any change in Petal's aggression since we started the pain medications, but I have noticed that she is moving better and getting up more often. Here, Gaston. Here, baby. Do you want to try it? Here, I'll put it up here. Maybe he'll jump back up here. And so she comes to her for attention. So she feels better because she's moving around more, and she's doing some of that to come to her person to get some attention, because she really does love this lady, and she doesn't need to be afraid of her and become aggressive reactive. So so we have not noticed that reaching to pet her, we have not been reaching to pet her, and sometimes she comes to us for attention. The hard thing is I have to handle her so much for her care that sometimes it's not an option to avoid touching her. I have to clean her, assist her with her physical therapy exercises, and put her places where she can't get to on her own. So we added another medication called Gabapentin. You may have heard of it. It's a very helpful, exceptionally safe medication. It's often used as an add-on, not only for anxiety, but also for pain. So we added it to the carprofen, the Rimadyl. It works very, very differently, and it helped this dog, except that initially she wouldn't take it. Now, most dogs and cats, you can open the capsule and dump the powder inside the capsule onto their food, and they like the taste. Not Petal. So we contacted a compounding veterinary pharmacy. The one I like the most is in California. It's called Triad Compounding Pharmacy. And I like them because they give great service. They ship stuff out right away. And if a pet doesn't like the taste of something, they'll mix it again at no charge until they get one that the pet will actually like and eat. Well, Ron, the pharmacist at Triad, went ahead and sent it out in a chicken-flavored liquid for Petal, and Petal ate that just fine. So her person measured it onto her food, and it started working within a couple of hours. And so I was actually accomplishing two rather separate things by adding the gabapentin. We had Petal being less anxious and less explosive in her aggressive reactions, which is often a very specific reason to add gabapentin, and we were being much more effective at controlling her pain. And so we got a lot of very good benefits from the gabapentin. They were very, very happy. Well, that wasn't all, because there was an anxiety component to this, because this dog was on the edge of her seat a lot. So we added one more medication, and we understand how these work. We understand what interacts and what does not. We understand the neurotransmitters that they affect. And so I added in something called Fluoxetine, which is the generic name for Prozac. Obviously, it is a widely prescribed antidepressant in people, but it is a mighty reliable anti-anxiety medication in dogs, especially when it is manifest with aggression. We use the canine-approved brand Reconcile. It's chewable, which actually Petal did like that. And we were able to start using that on a daily basis. Now, it takes a few weeks to become effective, but once we had that on board and we were reducing anxiety that way, reducing aggression, reducing explosive aggression, and reducing pain in two separate ways, and now the physical therapy was going much better because they could actually handle this little dog. And so she did so much better. We were just delighted. And most importantly, so was Petal. So then we went into what we call response substitution. In other words, teaching Petal a new behavior instead of the behavior that that was inappropriate. Carolyn, would you mind? I meant to bring it up here. In that drawer downstairs, I have my click stick that I often take when we walk Miss America. Would you mind grabbing that? Thank you. I intended to bring it up and I spaced it out. But I want to demonstrate just briefly how this thing works, because it is a great way to teach a dog that we're going to abandon old behavior, and we do this with cats too. We're going to abandon old inappropriate behavior, and we're going to do something else instead, and very specifically involves earning a resource from the leader. So the dog's attention is totally shifted, and they're going to do something very appropriate instead of, in the case of Petal, reactive aggression. And then there's one more thing that we can do that I'm going to demonstrate on Miss America here in just a minute. Oh, here it is right here. Thank you, Carolyn. So this is called a click stick. And let me just show you this thing. In fact, I will turn this around and I will show you the name on it. There it is, click stick. You know, they've got to be fancy and misspell it intentionally. Anyway, the click stick is really nothing more than a target stick. Many people teach dogs and cats to target. Look at Miss America, she already gets it. Maddie, target. There you go. We use her given name. And I always give her a treat. And Carolyn, can you give me some more cat treats? I'll give her a cat treat. I'm totally out of them. The nice thing about a clicker is that, and this click stick in particular, look at how interested she is. She associates good things with this. You see the clicker button on that? It's right there where your thumb belongs. Thank you very much. And you click immediately after the good behavior, but the food can come at any point. Yes, I know, honey. So when they had Petal and needed to do something with her, like in physical therapy, and handle her, the first thing they did was bring out the click stick after teaching her to do it. Maddie, target, touches her nose to it, and it gets the immediate click, and then she knows from thousands of repetitions, this border collie, that food will always follow. And of course now we've got competing interests between a cat who's getting the treats and Miss America who gets a cat treat. Okay, yes, I know, that's all we're going to do. We do that to direct her attention toward us instead of chasing cars. It's a response substitution. Looks like I have a question here. Let me get the iPad here. And we had a question from, there we go. Oh, Sally Foote is there. Hey, wonderful. Dr. Sally Foote is one of my colleagues in the behavior specialty. And hello, Sally. She sends her greetings. She's a wonderful behaviorist. Sally, remind me, where the heck do you practice anyway? Sally Foote says, I think gabapentin is the most underused medication in veterinary medicine. I love combining this with fluoxetine as well. Yeah, well, Sally is trained the same way I am, and I've got to tell you that gabapentin is about as safe a medication as we have anywhere. It turns out there may be no upper limit to its dosing. If we find that we get a good result and we bump the dose a little higher and keep doing better, finally we can get high enough with it that it can cause a little sedation, well then we back down. But it is a wonderful add-on pain reliever, add-on anti-anxiety, and the dermatology people now are using it as an add-on for some of the newer medications for itching to help bring that itching down a little bit further. It's wonderful stuff. So enough about Petal. Let me tell you another thing that we can add on. This thing right here is called the Assisi Loop. Assisi like A-S-S-I-S-I, like St. Francis of Assisi. I named one of my two sons after St. Francis. I actually went to Assisi back in 1990, and I was totally taken. I could hardly leave the place. Anyway, Miss America, honey, will you stand up? If you can see on this kind of black and white dog, I have this little outfit on her, this little wrap. It's called the Loop Aid. And the benefit of it is that it's got these little Velcro things, and then you Velcro the Assisi Loop to wherever the problem is on the dog, and then you turn on the device. And we've used this one so much as a demonstrator, the battery's worn out. Anyway, 2 sessions a day, 15 minutes each. The thing turns itself off. No sensation associated with it. You can use it with hair, dog's hair, bandaging material, even cast material. And the targeted pulsed electromagnetic field penetrates through all that stuff. And the dog, again, feels nothing. It's completely safe and begins working immediately. It has a different waveform than the Calmer Canine, also made by Assisi, which is used, and you may have seen me use that to help reduce anxiety in dogs, especially separation anxiety. But this thing has, it enhances the role of nitric oxide, which is the body's natural, one of the body's natural anti-inflammatories. And it also releases opioids, endogenous opioids, that is endorphins that we produce ourselves. You don't get addicted to those. And it can be used very safely with medications like the carprofen, the Rimadyl that we gave Petal. Can be used with Gabapentin, with Reconcile, with really anything. So it's a wonderful treatment by itself. Often physical therapy veterinarians are using it along with their work. We take pain really seriously. I got to tell you, if I have pain, I get very serious about getting that under control. And going back to cats and dogs, and cats in particular, Gaston, you're not interested in this fish. We'll have to teach you more about it so you're not afraid of it. Poor little.
I think I should have turned it on.
Yeah, it's okay. We'll work with him, and next time when we use it, I think he'll enjoy it more. Probably should have tried it before the Facebook Live. Anyway, we want to make sure we recognize pain, and oftentimes aggression. If you pet your cat, sometimes they're very itchy and they don't show that, and you touch them and they react. Dogs who react aggressively, but many times they get withdrawn. Sometimes they make it quite obvious by crying, but we need to be watchful and we need to have empathy. Not that we don't care for our pets and love them, boy, we do. But here's the empathy part of this thing, is that they are different. In many respects, they're very similar to us, but they're very different in some other very important ways in that they communicate differently. And I just got a message here. Yeah, Dr. Foote, glad you're demonstrating the loop to address pain as a part of a full treatment plan. Anxiety and pain are often, all right, Sally, what are you saying to me here, lady? Often, well, I'm not getting the rest of it, but she's right. They go together very often. They're often present together, thank you. Yeah, very often, and they get misinterpreted. And then people get frustrated. They feel betrayed by their pet who they love. They've done so many things to bring them into their life and to share affection, and the pet tries to bite them. Well, understandably, people get frustrated and sometimes afraid, and they'll react badly in ways they wish they hadn't by punishing. And, I understand those feelings. And I want you to know if you've made that mistake, you're not alone. People have done that. But if you've got a behavior problem, every case I see, and I'm sure Dr. Foote is the same, the first thing we do is look for every other physical problem outside the brain, which obviously is where behavior comes from. But what else is going on physically? And when I do an exam on every case I see, I'm manipulating joints, looking in the mouth, looking at the skin. Is there pain anywhere? Because if it's there, I'm going to find it. I want to make sure that it could be the entire cause of the reactive behavior. And sometimes it's not just aggression that pain results in. Sometimes it's pets who hide out, pets who avoid their people. What the heck's going on? Well, a veterinarian needs to figure that out. So even if the doctor is not a veterinary behavior specialist, the doctor can look for causes of pain. And we're all trained in that. So let's not miss that. Let's not overlook opportunities to help. Not only to diminish the pain, but see if we can figure out the cause. And in Petal's case, well, she needed that amputation. Treatment doesn't have to be that drastic, right? But it did in her case. So the empathy part of this thing is to recognize that members of another species, well, they're different, and they communicate differently. And if you're scratching your head wondering, what's this pet trying to tell me? Well, that's largely what veterinarians are for, even if it's not a behavior specialist. So that's an important part of this thing. It's part of the kindness that we feel for pets. And when we get that empathy puzzle right, and then we bring out the best in that pet by diminishing their problems, boy, that's a self-rewarding behavior for us, isn't it? And we come away knowing we did the right thing, and we can apply that empathy to other people who we know, not just to other pets. So I want you to stay here for just a minute. I'm almost done, girlfriend. So, the other thing I really want to share is that when we do that, when we listen and pay attention to the communication coming from other species like cats and dogs, then we can build a foundation of trust. And they can make choices. Just like Petal's person, very quick to realize I was correct when I told her, don't approach her, don't reach for her, invite her to come to you. And boy, did that really advance the relationship between her and that special little dog who's doing so well now. And so we need to know that if we lock horns and butt heads with a pet, they can become obstinate, just like another person can be when we miss the opportunity. We make the mistake and we lock horns. instead of sitting back and listening. So the same goes for these guys, but they are different. Okay, you can get down now. Okay, honey. That's a big girl. She's still wearing her Assisi outfit. Well, go to Mama, honey. Go to Mama, and she'll take that off you. Here, come here. Let me get this thing off you. Poor little dog. She's got to model this stuff because, after all, she is Miss America, and people like this, they have to be models. It's part of the deal. Boy, they make this Velcro pretty serious. There we go. Okay, girlfriend. So you can see a little bit better here. This is the outfit. It comes in different sizes, and I've just Velcroed the Assisi loop to it, and it makes it comfortable. Dogs can wear these things with their people. Easy to do. By the way, you can teach a pet to learn to trust at any point in the relationship. Trust that you won't inadvertently trigger their fear. So much of the reactive behavior we see in pets with behavior disorders are fear-based, and I explain that to their people, and folks go, "Really?" Yeah, really. And of course, they made the mistake that almost everybody does of interpreting the pet's body signals, postures, and behaviors through the human lens, when in fact they're members of a different species. So if you've got other questions, by all means post them on my Facebook page. I'd be happy to address them, and thank you for coming. And if you want my Facebook Lives every week in your email box, and along with my media blog, which is the column I write in the Albuquerque Journal from the week prior, then you can go to my website, drjeffnicol.com, drjeffnicol.com, and at the bottom of the home page you can subscribe, which of course is free, and then every Tuesday morning you'll get my question answer column from the Albuquerque Journal, and you'll get my Facebook Live from the week before. And when you do subscribe, I will send you at no charge my at-home pet CPR guide and first aid, which are worth printing out just in case something goes sideways. It's bullet pointed. Do these things. Here are the symptoms. This is what you do. Call the doctor. And a few of these things, they might look like emergencies. They maybe aren't. So give you some information to work with. Well, I hope you found this information useful. Thank you for sharing a little time on your Thursday evening with me. Miss America, who's gone back downstairs, and Gaston, who says, "I'm not sure about that fish thing, but I'll get it figured out later." They all say good night, and thank you for the hearts. I'm delighted to do these things. I enjoy sharing information and stories. So have a great week, and please be safe. And when you're not talking to an iPhone, please wear a mask.